Okay, this is our last class. This is a review. We're going to start by looking at an exam. We're not going to look at it. I'm going to read off of it. So you're not going to see it, but I'm going to read off of it. And we're just going to basically have like a little fun um, pretend quiz. And we're all going to participate. Everybody's going to, and then we're going to talk about tricks to memorizing things or to recalling things or recognizing things. Um, so we're going to start with that. My advice to all of you would be to go back and look at your past exams and quizzes, look at the questions, look at the answers. Many, 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 many are going to be repeated because there are only so many questions. Um, so look at those to study for the first, I guess it would be the first 11 or 12 chapters. I don't remember how many we, up to the last exam and quiz, so 11 or 12. And then today we're going to cover the last ones. So we're going to start with the last to give you an idea of what you should be studying for the last couple chapters that we did not have a quiz on. So I would study those. I would use the notes I provide you. I would look at the videos or watch the videos that I've recorded and put in YouTube for you. And you also have your textbook. So you have four resources. All right. So any questions before we begin? Again, the final exam will be cumulative on chapters 1 through 13, and it will open Monday morning. I'm thinking 8 a.m. and close midnight on Friday. You do not have a specific time to take it. That's up to you. Okay. Number one, the text defines mental disorder as what? What makes a mental disorder a mental disorder?
The
What are some
inability to maintain relationships, work.
good? Okay. If you remember that, you will get the question right. The answer is the behavior or emotional state that causes an individual suffering is self destructive, endangers others, and here you go, Hammer, or impairs a person's ability to function and work with others. Two, the primary purpose of the DSM is to,
is to help identify um, disorders, to
Diagnose.
classify, they're
diagnosing.
diagnosed. Yeah,
Diagnosing is the
classify
key.
that.
Diagnosing is the key word. Yep. Three, what kind of tests consist of ambiguous pictures, ambiguous sentences, or ambiguous stories that the test taker interprets or completes?
Ink blot.
That is an
What?
example of this kind of test. Correct.
Rorschach.
That is the ink blot, the Rorschach. Yes, that is an example of this kind of test.
What is that second word? Rorschach?
Rorschach. It's the ink blot test.
Okay.
But that's an example of the thematic apperception test is another example of this. All right,
I
so
got his name and I got the chat. That's from
good. So
chapter
what I would
3.
do is I would look up what the Rorschach test is, what kind of test that is.
No,
Question four.
it's slide 23 and 24.
Good. Then you will be able to find it. Okay. Sheldon is asked to report what he sees in a series of cards presented with symmetrical abstract patterns. What is he being given?
Ink block test.
Ink block test.
Rorschach ink blot test. Okay, so now it's asking you for question 5. Which assessment method listed would have the most validity and reliability? So in this question, you need to know what validity and reliability are. Okay.
I got it. I got it. I got the slide down for it, but I don't know what the answer is.
Okay. 6.
But it,
Candace experiences a continuous state of anxiety marked by feelings of worry and dread, apprehension, difficulties in concentration, and signs of motor tension. According to the DSM, this disorder is called
Panic
panic
disorder.
disorder.
a continuous state of anxiety.
Oh, anxiety disorder.
Yeah.
What kind of disorder?
I thought it was anxiety.
It is anxiety, but it's not. We don't just call it anxiety. It's a kind of anxiety disorder, like panic disorder. That's an
Oh.
anxiety disorder.
PTSD.
It is not PTSD. That's another anxiety disorder.
Yeah.
The key here is a continuous state of anxiety.
Ah,
Okay, let me give you the options.
I got it.
Let me give you the. Do you have it, Bob?
Well, no, I mean, I have it first.
Okay, let me give you the options. Is it a panic attack? Is it PTSD? Is it agoraphobia? Or is it generalized anxiety disorder?
Generalizing anxiety
Correct.
disorder.
Correct. 7. Johnny has recurring periods of intense fear, which he thinks he's having a heart attack. He trembles and has a rapid heart rate. These symptoms indicate what?
Panic disorder.
disorder.
Panic attack is a panic disorder, correct. 8. After surviving a commuter train derailment, John experienced frequent vivid thoughts and images of the accident for several months. He also had problems sleeping and was irritable and withdrawn. What is he suffering from?
PTSD.
Yes, Steve.
Correct. Number 9, what is a disorder in which a person feels trapped in repetitive, persistent thoughts and repetitive, ritualized behaviors?
OCD.
Correct.
OCD. Yeah.
Obsessive compulsive disorder. 10, Ramona has lost her interest in gardening, which brought her joy in the past. She's lost her appetite, and life seems hopeless. Which disorder would Ramona be most likely to have?
Depression.
Correct. 11, the vulnerability stress model describes what?
See, that would be something I'd have to look up.
Okay. "12, Mark would bite and hit other children in his preschool class, and by the time he turned 10, he started shoplifting and skipping school. His teenage years showed a pattern of cheating at school, stealing from a part-time job, selling drugs, and stealing cars. Mark's developmental history is an indication of what?
Antisocial behavior.
Correct. And Bob, what stood out that made it antisocial?
Was when you said he was hitting kids in school, for one.
Okay.
When he was shoplifting, that's
Good.
2.
Good.
And I can't remember what you said towards the end because I already had the answer in my head, but
Yep. So
it was just the antisocial.
What was different between that, I'm not even going to say what the other personality disorder is, but you really can separate antisocial is breaking the law. Okay? Stealing from part-time jobs, selling drugs, stealing cars, shoplifting, correct. The 2 dominant approaches to understanding addiction and drug abuse are?
Can you repeat that, please?
The 2 dominant approaches to understanding addiction. The 2 perspectives.
Is cognitive behavioral therapy?
To understanding addiction, to studying
Understanding
it, not
addiction.
treating it.
Use and adverse effects?
Actually,
I don't know.
those address both. It is the biological model and the learning model. Okay.
No, that makes sense.
Okay, good. The biological is talking about, the physical brain. Okay. What's different about the physical brain that makes the person more prone to developing an addiction. The learning model is what experiences did they have that led to the addiction.
Right.
Okay.
Okay.
14.
Gotcha.
According to the sociocognitive explanation of dissociative identity disorder, therapists have what? They're asking, how does the dissociative identity disorder develop as a result of therapists doing what?
Implanting a seed
How?
and leading.
And once they reveal a different personality, what do, the therapists?
Praise, reward.
Good. That's exactly what it says. Rewarded
Really?
patients with attention and praise for revealing more and more personalities.
Oh, I got you. Okay. All right.
15. Which of the following statements is true of schizophrenia with regard to prenatal problems?
The fever. The flu. Developing the flu.
The
Damage
flu
to-
at a young
correct.
age.
Correct. Damage to the fetus may occur if the mother gets the flu virus during the first 4 months of prenatal development.
Yeah.
At this time, what explanations and treatments for mental disorders are dominant or most used?
Take it away, Bob.
No, cognitive behavioral therapy,
Okay. All right.
motivation. Am
Okay.
I
What's
off?
the most common treatment for mental
Medication.
disorders?
Medication?
And what perspective does that fall under?
Psychiatry.
You said,
What
well,
perspective?
Oh,
What approach?
the biological
the
approach.
Correct.
medical.
Correct.
Yeah,
The biological.
okay.
The biological.
Bio is the key there.
Yes. Yes. Okay. You guys are doing very well today. I hope you are getting a little more confident. Okay. 17. One of the troubling side effects associated with some antipsychotic drugs is
Weight gain.
correct.
Yeah.
18. A drug that elevates the levels of norepinephrine and serotonin in the brain by blocking an enzyme that deactivates these neurotransmitters would most likely be used to treat what?
Depression.
Correct.
Mhm. Good. That was good.
19. Suppose a new drug is developed which increases the activity of the neurotransmitter GABA in the brain. The drug is most likely to do what?
Increase the fire, the
GABA. What does GABA do? GABA is our major inhibitory neuron. Neurotransmitter, sorry. GABA is our major inhibitory neurotransmitter. So what does that mean?
it's the acid that works as a neurotransmitter in your brain.
So what does GABA's effects cause? What are the effects of GABA?
Central nervous system.
It is in the central nervous system. What does it do?
Reduces the activity of the neurons too.
Correct.
Which is
So what would you treat with it?
like muscle nerve damage.
Anxiety.
Anxiety is the answer.
I was thinking that, but oh,
I
anyway.
would have gotten there.
Tosh, you would also treat it for muscle disorders. You're correct. But for mental disorder, you would treat anxiety with it. 20. People suffering from bipolar disorder often are helped by taking what?
Lithium.
Correct. 21. Balthazar is being treated through a procedure in which electrodes are placed on both sides of his head and a brief current is turned on. This current triggers a seizure that lasts about a minute, causing his body to convulse. This type of treatment is known as
Electric shock therapy.
Also known as,
is
ECT.
correct,
T.
electro ECT is the answer,
Yeah,
which stands for electroconvulsive therapy. Well
I
done.
got it right here. Okay.
A therapist's goal is to delve into the unconscious processes of his patients. He is most likely to consider himself a practitioner of what?
Psychology. No.
What?
Humanist.
No.
Can you repeat the
Humanist,
question?
humanist would be looking at free will, personal growth, development, growth mindset.
Am I on the right track?
Yes. So, so that's one perspective. The question, Tosh, is that the therapist's goal is to delve into the unconscious processes of his patients. What kind of therapist is he?
Psychiatrist.
He's not a psychiatrist.
Or is he a psychologist?
It's a form of psychology. It's a form of psychological practice.
Cognitive.
It is not cognitive. Cognitive is thinking and thoughts,
Thinking.
which are voluntary, conscious thoughts. This is unconscious.
So a therapist that goes after the unconscious thoughts.
Correct. What kind of therapy is he practicing?
I have to look it up.
Okay, that's fine.
Hypnosis.
No, but it is a part of the subconscious. You're on the right track. Is it client-centered therapy? Is it rational emotive therapy? Is it
Psychodynamic.
Is it psychodynamic therapy? Correct.
I should know that, but
That's all right.
Who studies unconscious?
23. Systematic desensitization for the treatment of phobias is a type of what therapy?
oh, it has a weird name.
Nope, it's a simple one.
Cognitive.
It is not cognitive.
I figure if I keep throwing it out there, you
That's
know.
okay. Eventually, yes, you're right, actually. Is it psychodynamic?
No.
Is it behavior?
Behavioral.
It is behavioral therapy.
That's for what? Of being afraid?
Yes. Systematic desensitization is where you get the individual closer and closer to the thing that they have a phobia for.
Oh yeah, we talked about that, having a spider and then bring it closer and closer.
Yep.
What was it called? Behavioral what?
Behavior therapy
Oh, thank you. Jeez.
or behavioral therapy, but the answer here is behavior therapy. 24. Bill has always had a terrible fear of dogs, and it causes problems in his life. He tells you that his therapist is having him look at pictures of dogs while trying to remain relaxed. His next step will be to begin interacting with actual dogs and learning to remain relaxed. You might want to reassure him that blank is often quite successful.
Cognitive therapy.
Mm-mm.
I feel like that's behavioral therapy again.
It is a form of
It is.
behavioral therapy.
Yeah.
The answer is systematic desensitization again. So, which is a form of behavior therapy. Okay. 25. Cognitive models of therapy tend to focus on what?
The mind.
Thinking thoughts.
Thinking thoughts. Exactly. It is changing unproductive ways of thinking. Okay.
Well, I was kind of right.
Yes, the mind.
The mind.
Yep.
Oh, all right.
26. A
I was
cultural
good.
mismatch between the client and therapist can sometimes be a problem because
Diversity. Cultural diversity.
Bias.
okay, the Tosh and Caleb are both right. I'm just gonna the answer is worded differently. It may lead to misunderstandings based on cultural differences. What kind of therapy is often more effective than medication in the treatment of panic disorder, generalized anxiety disorder, and obsessive compulsive disorder?
CBT.
Correct. Cognitive behavioral therapy. Well done, Bob.
Hold on,
28.
let me write that down. Cognitive behavior.
28. Blank is a state of arousal involving facial and bodily changes, brain activation, cognitive appraisals, subjective feelings, and tendencies toward action. And these are all shaped by cultural rules.
Emotions.
Correct is the emotion is the answer.
Really?
Yep.
Wow. Good job, Amber.
Facial
29.
changes.
Exactly. Facial changes. Is that what you said?
Mhm.
Yeah.
Well done. See, good job. Okay. Because we had a whole talk about that, didn't we? Right.
Mhm.
Right. Good, good. All right. 29. 3 major components that psychologists focus on when defining emotion are
Um,
3 major components. So if you're thinking about emotion, how would you measure emotion?
are we talking things like facial expressions,
Okay.
body?
Okay. One of them is behavior, or what's called here action. What else would you look at? How would you know when someone is experiencing an emotion?
Body language or
Okay, so
facial expression.
that's behavioral again. What else?
Their words.
Huh?
Their words. Is that-
Okay, cognitive processes, what they're thinking. What's next?
Thinking, feeling, but how would they know that though?
cognitive and
What happens when people experience an emotion? They behave certain ways, they think certain ways, and what else?
they act.
That's the behavior.
Oh yeah. You know,
What other changes can we measure? How do you know if someone is startled?
they're scared.
Facial expression.
Okay, so their behavior. Let's say you can't see them. How can you measure if they've been startled?
They scream.
Let's say you can't hear them.
I have no idea.
Let's say you
neither.
put someone in a different room and you push a button and a loud no, and let's say it's in a whole different building. So you can't hear it. You can't see them. You push a button and the loud noise goes off. How do you know that they've been startled? How can you test it? If you were to go with, if you were sitting down next to somebody and you said, watch this, I'm going to push this button and it's going to startle them. And they're going to say, well, how do you know? Well, because I can measure their
Mindfulness. No.
Reaction.
how can I measure their reaction without seeing them or hearing them?
Guessing.
I feel like you're having too much fun with this.
I am having too much fun with this.
Yeah, because
What if you put an electrode or a heart monitor on them?
their heartbeat would
Right.
go up.
Right. So the 3 major components that we focus on when we define emotion are behavioral changes, cognitive changes, and physiological changes.
Logical change.
Oh, physiological.
Or could it be biological changes?
Yes.
Or okay.
Yes. But this is a part of the biological.
How do you spell physiological? Whatever that word is.
Physiological.
Yeah.
PHY
Mhm.
SIOLOGICAL.
Thank you.
Physiological. Okay. 30. Facial feedback is defined as
Expressional.
expressed is in the answer. Facial
Depressed?
feedback.
Depressed is in the answer?
Expressed.
Oh, they're by their expression.
Okay. What is the facial feedback hypothesis? What's the idea?
That I don't know off the top of my head. But
So
I'm
like
looking up.
if you feel if you associate sad, you start feeling sad.
Say that using different words, Tosh.
Your facial expression
Yes.
results to your
Yes.
feeling.
Yes. So give me an example, a real life example.
If you told me to cry
Yes.
and I started to cry, I
Yes.
would start feeling sad.
Correct. That's exactly how it works. Right? So we tell our children, hey, turn that frown upside down. And if you can get them to smile, they actually do improve their mood.
I do remember us talking about that now.
Me
Yep.
too.
Good. Okay. 31. According to the concept of facial feedback, when Noah complies with instructions to smile and look happy, it's most likely that
It makes them happy.
correct. His positive feelings will increase.
Mm-hmm.
32. 3-year-old Xavier sees his dad dressed up as a gorilla, and Xavier screams in fear. What brain structure is probably involved in his reaction?
His
Fear.
Adrenaline.
What brain structure?
His behavioral therapy.
his cortex.
What? Nope, it's not his cortex.
Oh. Wouldn't it be his frontal lobe? No.
It's actually not in the frontal lobe.
It's that thing.
It's not in the brainstem or the hindbrain. It's actually in the midbrain. All right, here are your
I
choices.
can picture the slide with that, but I can't think of the word.
Here are your choices. It's not the hypothalamus, but it's very close to it.
What is that other little thing?
Thalamus.
It is
Come on,
not the
somebody better
thalamus.
know.
Go ahead, give us our choices.
Okay, every time I try, you guys start yelling stuff out. So, you ready?
Yep.
Is it the olfactory bulb? Is it the amygdala? Is it the occipital lobe? Is it Wernicke's area?
Amygdala.
The second one
Correct.
you said.
And that
What
is
was
what?
The occipital lobe or something? No, the one you said second.
That's correct.
And I can't remember what it was, but I know that's it from picturing the slide in my head.
Yep.
What was it?
Is it the olfactory lobe? Is it the amygdala, the occipital lobe, or Wernicke's area?
Amygdala.
Amygdala.
Amygdala. Yep.
No, amygdala.
Yes.
That's a smaller portion. I think it's, what side is it on, left or right?
It's on both sides.
Oh, it's on both sides.
Yes. Yep. 33. Dr. Cabot is recording from a mirror neuron in a monkey's brain. When will the neuron fire?
I remember this from a test. I got it wrong. When he sees it and when he's doing it.
Correct. When the monkey is performing a specific action and also when it watches someone else perform the same action. Correct. 34. Many researchers believe that mirror neurons allow humans to experience what?
Empathy.
Correct. 35. What part of the brain secretes epinephrine and norepinephrine? Let me take that back. I'm sorry. What part of the body secretes epinephrine and norepinephrine when the sympathetic nervous system becomes aroused?
It's not the hypothalamus thing. It's
Right.
Is it that structure
It is in that axis, yes.
that,
Hypothalamus communicates to the pituitary. Pituitary gland communicates to the
not the neurons, but the,
all right, look up the HPA.
is it axis or something?
It starts with an A.
Well, then I know what it is. I just can't
So just
figure
look
out
up
what
the,
the,
just look up the HPA axis, and there's your
The
answer.
medulla.
It is, does the medulla start with an A?
Oh, adrenal gland. Adrenal
Yes, say
gland.
that again, Tosh.
Adrenal gland.
The adrenal glands, correct.
No, it doesn't start with
I
an.
know.
36. The influences of thought on emotion was studied by assessing athletes' reaction to being among the medal winners in the 1992 Olympics. The results showed that second place winners were
Less satisfied than
Less-
third place winner.
correct.
Yep. And there's another question that goes along with that too, about the facial expression.
Well, let's see. Yep.
Okay.
Okay. 37. Which of the following emotions is a prototypical emotion? Meaning, what's a primary emotion? Schadenfreude, happiness, shame, or nostalgia?
Happiness.
Correct. 38. What do we call social and cultural rules that regulate when, how, and where a person may express or suppress emotions?
Norms.
That's a great guess, but that's not it.
Social norm.
That's a
Okay.
great guess, but we're talking specifically about emotion expression. So we have a special term just for that. $39. Okay, let's go through the choices. Is it emotion prototypes? Is it display rules? Is it
Display rules.
correct?
Mm-hmm.
39. The expression of an emotion that a person does not really feel is called?
Faking it.
It is, but there's a term.
Well, yeah.
Displacement.
It is not displacement. That's a defense mechanism. Is it facial feedback? Is it secondary emotion? Is it emotion work? Or is it body language?
Facial
Two.
feedback.
What?
Body language.
It is not body language.
And it's not facial expressions?
It's not facial feedback. It's expressing an emotion that you don't really feel, like a flight attendant or a cashier.
Secondary.
It is not secondary emotion,
There's one left.
and that's emotion work.
Mhm.
So think of it as like working on your emotions or making your emotions work overtime kind of thing.
Is what now? What was the answer to that?
Emotion work.
Okay.
40. Which occupation would be more likely to require emotion work as a job requirement?
Flight attendant.
Yeah.
That is true, but that's not an option. So what else do you have?
Teacher,
That's true, but that's not an option. So what else? I just gave you the
therapist,
two. That's true too, but okay. Is it a customer
Public
service?
service.
Yes,
Yeah.
correct. It's a customer service representative. 41. What is the one emotion that North American men can express more freely than women?
anger,
Correct. 42. What is the correct order for the stages of the general adaptation syndrome? Just look it up.
what is that called again?
General adaptation syndrome. The idea is that when we are exposed to chronic stress at heightened levels, we get sick. 43. Casey hears a rattling sound. I'm going to skip it because it has to do with the general adaptation syndrome. Okay. 44. What do we call the study of the relationship among psychology, the nervous system, and the endocrine system with the immune system? It's that long word. Psychology, the nervous, endocrine, and immune system. What we call the study of it. '45. Realistic optimists are more likely than pessimists to do which of the following? What do we know about optimists?
They're half full. They're always looking at the best, looking for the best.
Okay. What else do we know about health and optimism?
It's better for you cardiac wise. It's just everything.
Okay. And so so just find what we know about optimists in your notes. Let's try this. I'll just tell you what the options are. I don't want to do the other one because they were so repetitive and long. So, all right. So here's the question again. Realistic optimists are more likely than pessimists to do which of the following? Is it deny their problems, take better care of themselves, use passive problem solving, or refuse to take medications for illness?
Is it B, take better care of yourself?
Correct. They tend to take better care of themselves. Correct.
Well, I thought it was one of the first two.
46. As Molly looks at the grade scored in her final exam, she thinks, I did well on this exam because my roommate helped me study. Molly's thoughts suggest that she has which locus of control? Is it internal or external?
External.
Correct. Because she is putting the responsibility or putting the ownership onto her friend, the roommate. Yes. If she said, I did this because I'm smart, that would be internal. 47. Which is the key characteristic of the type A personality that is related to heart disease? And what we talked about was they looked at, I forget how many medical students, they were male medical students, and they took ratings of their blank, and they looked at them later on. And the ones who had the highest rating of this characteristic also had the highest ratings of heart disease. It was not stress.
Anxiety.
It was not anxiety. Is it working hard, or impatience, or hostility, or having high standards?
Hostility.
It is
High
hostility.
standards.
It is
Is
hostility.
it hostility?
Yes, it is. 48. Which stimulus is most likely to increase oxytocin levels in a human's brain?
Oxytocin.
Oxytocin.
It's not sex, is it?
It's close. Yes, kind of.
Orgasm.
It's well, yes, that's true. It absolutely is orgasm, but that's not the answer. It's an affectionate touch. If orgasm was in there, that would have been the better answer. That was it for 11 through 13. I think you guys did really well. Don't you?
Yeah,
I'm surprised.
I'm
me
ready.
too.
I'm ready for it.
Right. I'm telling you
I
guys.
am
You
too,
learned
because
a
I
lot more than you think you learned. This happens every semester where students feel like overwhelmed, stressed. I get it. But you guys always learn more than you realize. You do. I'm going to stop recording.
This class is awesome.